This is an overview of Green Beacon Solutions' patient health case management solution built on Microsoft Dynamics CRM and Microsoft SharePoint. The solution allows you to manage from first point of contact all the way through the recovery of a patient's case. We begin with my dashboard. The dashboard allows you to present information out to the end user to really help them through their day. We have different charts and views to allow me to organize myself. For example, I don't necessarily need to see all the cases that I'm handling, but I just want to focus on my high priority cases. But where do these cases come from? Maybe it's from an initial call from a patient or prospective patient. We track the initial call through a call log. This call log allows us to capture as much information about the patient during that initial contact as we can. We can track all different types of data points about the call, where it's coming from, how did they hear about us, if there was a referral. We can track information about the client themselves. While we're on the call, we might want to check for availability. So we can go to other applications, do searches, find out whether the patient is eligible, and if so, we can then manage and take the initial call and perform an intake. So as we close the call out, I can go to the intakes that I have, and I've got one here for Frank Johnson. The intake is more or less a collection of all of the potential information that might help us in the management of the case. As we go through, we can understand all the different types of information that's important around this initial patient request. We can capture dialogue with them. We can track medical history, what they have for their presenting treatment, as well as a review of their systems. What are the risk types that we're dealing with around potential systems within the patient? Social history, family history, medications, allergies, all different types of data points that will help us in the overall assessment of the patient itself. Based upon this assessment, workflow can kick off, which will automatically go and create a case for Frank Johnson. So as I go to my cases, we can go and look up Frank. As we open up this case record, we'll have that information from the intake automatically brought in and available to us. Based upon the type of case, the stage that we're in, the timeline that we've associated to it, again, workflows can be kicked off to allow for process to be automated with the creation of tasks and activities and reminders to make sure we're staying on top of the case. We can also set up case contacts, all the other people who might be involved in the management of Frank Johnson. The benefit here is that we can also set up SharePoint access for these case contacts, allowing us to share information, share documents, notes, and other details out to them by giving them access through a SharePoint site versus making them an active member within the CRM solution. Again, we're tracking a lot of the medical information. We can track workers' comp details and any additional information that might be important. But the main purpose of the case itself is to eventually have the patient on a plan to recovery, and those can be managed through our case activities. So we can set up different milestones or recovery plan tasks that are going to enable Frank to get back to his regular way of life. From the case itself, we can go add additional milestones or tasks. Here we can see the existing tasks that are leading to Frank's recovery, and then we can go and add additional tasks. And we've built a library which allows us to go through and determine what types of activities are we going to try to help Frank with. In this case, we've got some medical care that we want to make sure that we're taking care of, and the first thing we want to be able to do is assess the need for the facilitation of Frank's medical care. So by adding this task, we can start loading in additional details. In this case, I can say the status, and at this point we are going to schedule this activity. The responsible point of contact will be the case manager, David Arnold, and this goal is for the actual client. But again, we can determine other people who might be involved in the recovery of this particular patient. I can set up the initial start date. I can define the end date. So maybe I want to end this in September. The system will automatically go and calculate the expected duration as well as initial alert dates to make sure, again, we're staying on top of each of the activities in the management of Frank. As I create the case, it will go and add that to our list of tasks that need to be performed. As we add these tasks in, again, these can be shared now outside with the doctors, nurses, and additional people who might be involved with Frank. So as I go and close out the case, here we've created the case management portal, allowing people who might be involved in different cases to be able to interact and share information. In this case, I've got 3 cases that I'm responsible for, but we can also see additional types of documentation and notes that we can share. If I open up Frank, this will now take me to information that I, as an external user to CRM, can go and review. So here again are those different tasks that we've just set up within CRM that I can go and update. We can share documents, so whether it's referrals, exam notes, etc., those can be shared, as well as just the overall case notes as I go through and update the information that I have about each patient. So again, giving that additional access outside of CRM to users to really help facilitate the sharing of information and get the patient itself on their road to recovery. As we return to the dashboard, we also have the ability from the dashboard to drill in and analyze different types of information. In this case, if I wanted to go and look at my different cases by priority that are coming in over periods of time, I have the ability using the chart to say, okay, I just want to focus on some of these high priority ones. So with a simple click, it's going to narrow it down to the specific cases that I'm working on from that particular day. We can also use the filter. So if I wanted to filter by, in this case, service line or stage or who's responsible, very quickly and easily I can filter those down. I can save new views. So if these were just my high priority cases from a particular day, I can do that. You also have the ability to create and build out your own charts. So if we wanted to be able to go and look at different cases by priority, it's going to let us be able to go in and review that information as necessary. So in summary, what we've done is built a solution that allows us to take a case from its initial contact point all the way through the recovery of each patient. This enables you as an organization to have a single point of contact or reference for all of your patient case management needs. For over a decade, Green Beacon Solutions has been delivering and implementing solutions within the government space around CRM and SharePoint. For more information, please visit www.greenbeacon.com. Thank you and have a good day.